Hi, how are you? Good. My name's Nani. I'm the nurse working with you today. So I have good news. It looks like you're ready to be discharged today. Yes. So I do have some discharge paperwork to go over for you before we have you sign our paperwork so that you can go home with your baby. Now I do have the paperwork here with me. I have a packet to give you with some important information, just about your general health as well as your baby, some tips and tricks, some information, just to make sure that you're all set to go home. Okay? Good, alrighty. So just really quickly, can you confirm your name and your date of birth? All right, I just want to make sure that it's what we have on our paperwork. Okay, and can you confirm the baby's name and date of birth? Good, alrighty. So I see here, just looking over generally the history from your delivery, it says that today is day 3 postpartum. Okay, good. And you had a normal spontaneous vaginal delivery. Okay, no issues there. Okay, perfect. That's great to hear. Okay, and you have a baby girl. All right, and she had hyperbilirubinemia, so high bilirubin in her blood. Yeah, that's why she was a little bit like yellow, and skin color was a little yellow, eyes were a little yellow. Yeah, so I see here you and her are both stable now, so you're ready to go home. Okay, and you do plan on breastfeeding? Okay, okay, perfect. Awesome. So I have some information to go over, like I said, and I'll hand this paper to you once we're done. I'm just going to be going over some things. Of course, yeah. And then at the end, as I mentioned, I'm just going to have you sign some paperwork, just agreeing to the discharge and agreeing to the follow-up appointment and everything. But we'll talk about that in a sec, okay? All right, perfect. Yep, so again, my name is Nani. Yep, I'm the nurse that's working with you this morning, just in charge of discharging you. So I'm excited that you guys are going home today. That's nice. Is this your first baby? Okay, yeah, so a lot of this information is going to be really useful, I think. Yeah, of course. So I'm going to talk to you about some important things regarding you and your baby. And the first thing we're going to talk about is the discharge. This is common after vaginal deliveries. Yeah, I know you've been noticing it, I'm sure. Yeah, so this is called lochia. This is common after birth, especially when you have a vaginal delivery. Now, that's going to last up to 6 weeks. And what you can expect and notice from the color of that blood that's going to be coming out, that lochia, is that it's going to change over time in color and consistency. So over the course of the next 6 weeks, you're going to notice that it's going to turn from that red color that it is right now all the way to a grayish white. Now, if you notice that it goes back, it regresses and becomes red and bloody again, or if you notice any large blood clots that you're passing, it could be a sign of unwanted bleeding. So if that happens, you should seek medical attention immediately, okay? Yeah, but again, it is normal to have discharge. Just again, we don't want it to, once it starts dwindling out from being that red color, we don't want it to go back to being bright red. Yep. Okay, do you have any questions about that? That's a good question. Yeah, so since you do plan on breastfeeding, it's normal for your period to not return for another 3 months. 3 to 4 months. It really varies depending on the mom, depending on hormones, but that is pretty normal for it not to actually come back for a bit, because breastfeeding causes hormonal changes. So if your period doesn't return within that time, don't panic. It is common for it to take a while to come back. Now, even though your period might not be back, just remember that you can still ovulate before your period returns. A common thing that people sometimes hear is that if they're breastfeeding, they can't get pregnant again during that time. That's not necessarily true. Although breastfeeding can prevent ovulation sometimes just because of the hormone shifts that are going on, it's not necessarily true. You can ovulate before that, before your period returns. So if you do have unprotected sex, it can result in another pregnancy. So just something to be conscious of, okay? Yeah, but great question. So again, since there's going to be discharge in that area, it's important to keep the vulva and the perineum clean, okay? So we do have it noted on here, but just some typical stuff to go over, both for now and in the future, even when you're not having discharge. Anytime that you are using the toilet, just avoid flushing while you're still sitting on it. We don't want any of that water to splash up when it's like dirty water, Always remember to wipe from front to back. So use a moist washcloth, wipe front to back, and gently pat the area dry with a clean cloth. Again, front to back, because we want to avoid getting any infections there. Yeah. Yep, of course, same as always, just front to back. Yep. And then you're going to use a clean cloth to pat dry the area. We don't want it to stay moist because that can cause more bacteria to accumulate and stuff. Yeah. So it is common for the vulva and perineum to be sore and swollen for a few days, especially since you had that vaginal delivery. Yep, that is completely normal. Now, you can use a heat pack to help alleviate the pain. You've been using, yeah. Yep, I saw on the chart that they've been using some. Okay, and it's helped. Okay, good. Yep. And then when you're sitting or laying down, you can use a soft pillow or a pad to make it a little bit more comfortable to sit down, add some cushioning there. If you need any additional pain relief, you can always take Tylenol. Just remember with Tylenol not to exceed 3,000 milligrams every 24 hours. Yeah, so the maximum to take is 3,000 milligrams in a 24-hour period, okay? Yeah. Okay, now going over some breastfeeding stuff, since you are going to be breastfeeding your baby. And I'm also going to talk a little bit about your health overall, your postpartum health. So I know breastfeeding can be a little bit daunting, especially to a new mom, but we're gonna let you know how to do things, make sure that you're doing it right, and I'm sure you'll get the hang of it over time. It is somewhat of an adjustment, of course. Yeah, so breastfeeding starts with a proper latch. So you're going to position your baby with her head tilted slightly back. When she feels your breast by her lips, she's going to reflexively try and suck. So she does have a reflex that allows her to do that. When she does that, she'll be sucking over a wide area of your nipple. So don't have her sucking just on the tip of the nipple. You want to make sure that she's latching onto a nice big area of the nipple, including the areola, basically. Yeah. So it should be far back in her mouth, the nipple. And when she does that, the latching process, it shouldn't hurt. Okay, so if you do feel that it hurts, we might need to have some type of follow-up with the doctor. Yeah, it is common for the nipples to get sore, but if there's a lot of pain, there's definitely something that can be done about it to make sure that you're not in pain when you're breastfeeding, okay? Yep. So you can tell that the baby's breastfeeding correctly if she's not fussy, and you'll also hear her swallowing the milk without any loud pops or cracks, okay? It's also common for babies to sleep in between meals. So if she goes right to sleep after you feed her, that's a good sign that she's getting enough milk, okay? If she's remaining awake, then maybe she's not getting enough. But not necessarily. There's a lot of things that can, contribute to a baby being fuzzy and stuff, but definitely something to keep an eye out for, okay? Yeah. So we do encourage you to breastfeed whenever your baby feels hungry, and she will be crying. That's usually a sign. You'll learn to know it over time. You'll learn to know kind of the signs of when your baby is crying because she's hungry. Yep. Now, since your baby still has some of that hyperbilirubinemia, the high bilirubin, feeding her at least 10 times a day is going to help reduce the condition. Yeah, so the reason for that is that usually when you're breastfeeding 10 times a day, it's going to help keep her hydrated, she's going to stay well fed, and she's going to be able to have more stool movements, bowel movements. So every time she passes some stool, it's going to help get rid of some of that excess bilirubin. Yeah. Now, I know 10 times a day can seem like a lot, it can seem kind of daunting, but again, we're here for you if you have any concerns or you need to talk to anybody. I know it's a lot to take in, so yeah, of course. Now, if you do have any issues with feeding or lactation, if you have any concerns that come up after you've been discharged, just give us a call. We're more than happy to set up a consultation for you with a lactation specialist. Yeah, there's people that specialize in it, so they can help go over everything again if you need to and make sure that everything's going okay. Yeah, of course. Now, more going towards your health and your physical and mental well-being. So when you do feel ready for activity, remember that for the first 3 weeks, you should avoid any heavy lifting or super strenuous physical activity, okay? Yeah, so as far as lifting, don't lift anything heavier than 10 pounds. Ideally, the heaviest thing you should be lifting is going to be your baby, okay? For those first 3 weeks. If you want to exercise, remember it should be light to moderate, like yoga or walks. Those are great. Exercise is always recommended. It's going to help when you're able to tolerate it, of course. It can help you recover physically and mentally. And it's also some time for yourself. You're going to be with the baby a lot, and you're definitely going to need some me time. So, you know, we encourage you to do your exercise and take that time to kind of relax. And yeah, of course, exactly. Yeah. So, of course, we know it's very important to take care of your baby, but it's equally as important to take care of yourself. So we recommend that you prioritize rest. You're going to feel fatigued. That's normal. We would recommend whenever the baby's napping to also try to take naps at that same time. If you have a support person at home that you're able to rely on, we would say to try to rely on them. If you ever need a little break, if you feel tired, try to get somebody to help you out if possible. Do you have somebody at home that you feel comfortable with helping out? Like, okay, great. Good. Okay, awesome. So yeah, so if you do have a support person, it can be anyone really, someone that you feel comfortable and safe with, that you also trust with your baby, of course. Anytime that you need a break, please try to emphasize that you also need to get better, and you need to recover from the physical toll of pregnancy and the childbirth. And raising a baby is a lot of work, so please don't be ashamed if you feel like you need to take a step back. Everyone, lots of moms go through that, and it's very important to take care of yourself, okay? And again, it's important to take care of your mental health. So the baby blues are common, and sometimes it's a result of hormonal changes happening in the body. Other times it can be a result of stress. Again, being a new parent is very stressful. There's a lot of changes, a lot of new adjustments that you're going to have to make, of course. So the baby blues, we say, is more like a slight feeling of sadness, but not so much a heavy depression. But it is common to feel some type of sadness, maybe even disappointment. It doesn't mean that you're a bad parent. It is a normal thing that happens, and again, a lot of the time it can be just due to the hormones and all the changes that are going on in the body, okay? Yeah, so give yourself some grace, okay? You don't have to be perfect. Yeah. So the important things to remember again are that you aren't the only mom to experience these feelings, okay? After childbirth, it is common to have the baby blues. Rely on your support system whenever you can, and if at any point you feel that you're not having that support at home, or you need a little bit extra support, You can always feel free to reach out to your provider, see if they can point you to any resources. Maybe in the community there could be support groups for new moms as well. There's a lot of different things that are available nowadays for new parents, okay? Yeah. Some things to help to alleviate baby blues are, of course, breastfeeding. It actually does help calm you down usually. And exercise. That's also really good for your mental health. Self-care, doing activities that you enjoy, all of that good stuff, okay? And if you feel an overwhelming sadness or any anxiety, especially after the 6-week postpartum period, it could be a sign of a more complicated postpartum depression. So in that case, we would want you to contact your provider and follow up. We want to make sure that there's nothing deeper going on, and if there is, we want to make sure that it's addressed properly, okay? Yeah, but of course, your health is just as important as the baby's, okay? Yeah. So moving on to the next point on here, we do have some information about your baby, safe sleeping, feeding, and umbilical cord care, okay? And that's all labeled on here as well. So one of the most important things that you can do for your baby is to ensure they're sleeping safely. So we recommend always putting your baby on her back. So the saying that we use is back to sleep. You're putting them back to sleep, you're putting them on their back, okay? So we also recommend that the baby sleeps by herself. Co-sleeping, even though some parents do like to do it, and some people believe that it facilitates bonding. However, it can be dangerous for the baby. It increases the risk of sleep-related deaths. Of course, a lot of the time it's accidental, but we really want to try to limit that because we don't want your baby to be harmed in any way from the sleeping habits there, okay? Now, the baby's crib should have a snug-fitting mattress sheet. Don't have anything loose on the bed that the baby's going to be sleeping in. It should also be free of any pillows, blankets, toys, or any other items that can cause suffocation during sleep, okay? I know a lot of the times, you see pictures, it's really cute to see the babies laying in their crib with a bunch of fluffy blankets and all these different like plushies and things. And while it is really cute, it can be dangerous when they're sleeping because babies normally can only breathe out of their nose. They haven't learned yet how to breathe out of their mouths. So if you cover or if something ends up blocking that nose, that mouth, it can really cause them to suffocate. They won't be able to breathe, and we don't want to end up with any issues or even death, from that type of thing. So a handy way of remembering this for safe sleep is the ABCs of safe sleep, and that is listed on here, so we're going to give this to you just so that you remember. But ABCs stand for alone, in her back, on a crib, okay? So alone, back, and crib. Yep. So now babies, they're going to tend to go to the bathroom a lot, as I'm sure you've noticed even over the past few days. Yeah, so they're going to poop and pee several times a day. That's completely normal, okay? Be sure to always wipe front to back for her to prevent any infection. Same way that you wipe from the front to the back, it's going to be the same thing for your baby, okay? If it happens to be a very messy diaper, you can wash with some warm water, pat the skin dry, make sure that everything's nice and dry. We don't want any excess moisture there that can cause irritation, okay? Remember to stay on top of the diaper changes, keep your baby healthy and clean, okay? Now, since you do have a baby girl, it is normal sometimes to see some blood-tinged secretions from the vagina in a baby girl. So you might see this when you're cleaning her or on her diaper. This is normal, so it's not a cause for concern. It's called pseudomenstruation, okay? And it's caused by the maternal hormones, and it goes away in a few days, okay? Now, if you do notice some blood after a couple of days, then that might be a cause for concern, and you can always call your provider and discuss, and we can make sure that everything's okay. Call the baby's pediatrician, Yeah, but for the first few days, if you do notice a little bit of some slight blood colored discharge, that's completely fine, okay? So now for the baby's umbilical cord, so you do need to make sure to clean it, okay? So whenever you're putting the diaper on the baby, be sure to fold the diaper in the front so that it doesn't rub against the umbilical cord. You want to keep the area clean with some nice washcloths, but the cord itself should not be submerged in water because it can cause infection. So you don't want to get the cord wet from submerging the baby in a bath or anything like that until the cord falls off. So the cord should fall off within the next week, but remember to do it on its own. So if it takes longer, it could be normal, but we don't want you to try pulling on it or picking it off yourself because that can cause injury to the baby, okay? Yeah, or it can cause infection. So yeah, exactly. Okay, so we're getting near to the end here, okay? So just a couple of warning signs to watch out for and then some information about your follow-up appointment, all right? So I know as a new parent, there's a lot of information to process. We just went over a lot. There's going to be a lot in the packet I'm going to give you, but it is very important. And again, we just want to make sure that you and your baby are leaving the hospital as to be as healthy as possible, okay? Yeah, so let's just go over a couple of the warning signs to look out for that could be a sign that you need to talk to the doctor or the baby's pediatrician, okay? Yeah, so as far as the baby goes, if you notice that she's having any trouble breathing, so this could be grunting, wheezing, nostrils flaring, any retractions in her ribs. So if you see that she's really struggling to breathe, please seek medical attention immediately, okay? It can be a sign of respiratory distress. There could be a blockage there or something going on, so we want to make sure that that gets addressed immediately, okay? If you notice that the baby suddenly has issues with feeding, if they're very restless, if she's irritable, it could be a sign that it's time to see a doctor, okay? Now, in terms of the hyperbilirubinemia, so again, that slight jaundice that we had seen that she does still have, if you notice that her skin turns a darker yellow or her eyes turn yellow, or if it starts to cover her entire body, or if she starts having trouble with using the bathroom, like pooping and peeing in her diapers, if you notice that the amount of wet diapers goes down a whole lot, please contact a provider, okay? Yeah, now she is doing a lot better though. She's stable, and those bilirubin levels should be going down the more that you're able to breastfeed and the more she's able to excrete that bilirubin like we talked about, but just some things to watch out for just in case, okay? Yeah, okay. Now for you, mom, as the person that, gave birth, just some warning signs to watch out for. So earlier we talked about the lochia and how it's going to be turning from the red color that it is right now. It's going to be dwindling and eventually it'll turn kind of like a grayish white color until it goes away, that discharge. If you notice that there's any vaginal bleeding that saturates more than 1 pad per hour, you should call the doctor. It could be a sign of a postpartum hemorrhage, as well as if you notice any large clots that you seem to be passing, anything like that could be a warning sign that there's some extra bleeding going on there, and we want to make sure to address that as soon as possible, okay? Now, if you notice that the discharge starts to get a foul smell, if it looks more like an off color, like a green or something like that, it could be a sign of an infection. So that's another thing that we'd want you to report to the provider, okay? Yeah, so Another thing to report to the providers on top of those changes is if you start to have any flu-like symptoms, or if you develop a fever higher than 100.4 degrees Fahrenheit, could be a sign as well of an infection. Okay. Okay, now if you feel in your legs any pain, swelling, notice any redness, especially in your leg or your calf, it could be a sign of what's called a deep vein thrombosis, which is a blood clot in the leg. This is a complication that sometimes can occur to moms that just had a baby. Okay, so it's something to watch out for. And again, the more you're able to engage in physical activity, the less of a chance that happens. It's more likely to happen if you remain in bed for a long time and aren't really moving a whole lot, but it is something to watch out for. If you notice anything like that, please seek care immediately, because we don't want it to cause any issues from it getting dislodged. Now, something that can happen if a blood clot gets dislodged is it could wind up in your lungs, and this is called a pulmonary embolism. So some signs of that would be if you have any sudden or sharp chest pain, any trouble breathing, or a really rapid heartbeat. So that could be a sign of a pulmonary embolism, which again is when a blood clot makes its way into the lungs and it can cause a blockage there. So that requires immediate emergency care. Okay, so if you have any of those symptoms, we would say either call 911, get in an ambulance, or have someone take you to an emergency room, because we want to make sure that that's addressed. Okay, yeah, exactly. So some other reasons to call 911 are if you have a persistent or severe headache, if you have blurred vision with nausea or vomiting, any hallucinations, any thoughts of harming yourself, others, or the baby. Okay, all of that could be related to all sorts of things. It could be postpartum psychosis, it could be, possible stroke, anything like that, infection. So we want to make sure that if you have any of those symptoms, you're going to call 911, get care as soon as possible. Okay, yeah. And again, it's not just for the baby, it's for you too, because your health is very important, and we want to make sure that we're keeping you, your baby, and everyone else safe. Okay. So I know a lot of this information, it's a lot, it can sound scary, okay, but they are precautions. Okay, so doesn't necessarily mean that any or all of that is going to happen to you, just things to watch out for, and report as soon as possible if you do notice any of that. Okay, and it's all going to be listed on here on this paper that I'm going to give you, so you don't have to remember everything and memorize everything necessarily, but if you ever feel like something's off, something could be wrong, you can reference this, give the provider a call, and just, it's better to be safe than sorry. So if you ever feel like something could be going wrong, it's always better to try to get help, get medical help, rather than just putting it off. Yeah. Yep. And we are giving this information to your partner as well, so they'll have it, as well as your support, any support people that you have at home. It's good for them to be aware of these things just in case. Okay. Yeah. Okay. So again, just remember, you're not alone. Lots of people give birth all the time, every day. So there's a lot of resources out there for new moms, new parents, and if you do need more resources, there's some phone numbers on the back of this sheet that you can call, but you can also call us, call your provider, see if we can set you up with any follow-ups or any community resources for support. Okay? Yeah, of course. All right, so one final thing, just regarding your follow-up appointment. So please just be sure to schedule a follow-up appointment for yourself with your doctor in 4 to 6 weeks, so kind of closer to the end of the postpartum period. Okay, and that's very important. We're going to check your physical and mental health, make sure that you're doing well and that your uterus has returned to its original position and size, because that uterus is going to go back slowly to what it was before you became pregnant. Okay, And then, of course, like I mentioned, just be sure to do the follow-up appointment with your baby's pediatrician. I know the social worker helped you out with finding a pediatrician locally for her. Okay, good. And you have the appointment set up already and everything? Okay, perfect. Yeah, so just, be sure to follow up, make sure that the baby's doing nice and healthy. They're gonna also help make sure that the baby's feeding properly, that she's gaining weight as she should, and all of that. So, yeah, so, if you do have any concerns about the breastfeeding thing or the bilirubinemia stuff, if her skin's like yellowish or anything like that, they can help address some of those concerns and make sure that everything's healthy and okay with her, okay? Yeah. Okay, so congratulations again on your baby, and I hope that you get home safely and that you both get adjusted to life with this new addition to the family. Yes. I can tell that you're excited though. I know it's a lot, but definitely exciting as well. Yeah, of course. So just remember to reach out to the provider with any questions that you might have. The phone numbers are all listed here on the back of this paper, and we're going to give this to you to take home. I can make copies as well if your partner or anyone else might want some, just so that they have for reference. Yeah, of course. So I'll hand this to you and I'll go print out some more copies to bring, okay? Now I do have a form here that I need you to sign. So here, let me put it on this. Okay, so I'm just gonna need you to sign right here. Okay, and then date right here, and I'm gonna sign it down here. It's just showing that you received the discharge education, that you're good to go. Okay, there you go. Good. Okay, thank you. Good, and I'm just gonna sign it as well. Okay, very good. Okay, so this is for you, Mom, and then I'll be taking these forms back with me, and I'll make sure to put that in your file, make sure that everything's good on your chart online, and then you should be good to go. We're going to go ahead and call the transportation. Yeah, you guys have a car? Okay, good. Yeah, so we'll call the transportation department and have them bring a little wheelchair up for you for now, just so that we can get you down to the parking lot a little bit easier. It is a little far. Yeah, so that way you don't get too, tired on the way there or anything. Since you're still just 3 days postpartum, I know it can be a lot to try to walk that whole length over there. Yeah, so we'll get that set up for you, and if you have any questions, any concerns, please let me know. I'm gonna go make copies of that paperwork for you guys to take home. Okay, alrighty. Anything else I can get for you before I head out? Okay, perfect. Alrighty.